I am Dr.K Gireesh, physician, neurophysician and neurosurgeon. On behalf of Padma Clinic and Nursing Home, and as a part of the continuing medical education program and the health awareness program for the general public, I am just talking today on a very important observation what you make when a patient becomes totally unconscious, or you say in a comatose state. When you look at that patient and give a pinch or a painful stimuli, there are two postures the patient can make, and those two postures have got a significance. One is a decorticate posturing and the other is a decerebrating posturing. So, one is decorticating posture and the other is a decerebrate posture. These two shows that the brain or the brain stem and the brain stem are severely injured, and the prognosis will not all that be good. Now, what is the decorticate posture? When the decorticate posture, you find here is the brain. You can see the human being with this brain, and in the decorticate posture, you have this. This is the posture of a decorticate posturing, where the upper limbs are flexed, adducted, wrist is also flexed and fingers are also flexed. The moment you give a pinch, the fingers and the hands and the upper limb will go like this, and the legs will again be extended, internally rotated and plantar flexed. So, this is what exactly happens in a decorticate posture. When you pinch a comatose patient, you will find exact posture will be like this. Both the upper limbs flexed, adducted, the hands also adducted, fingers are also flexed, and the upper limbs are adducted, fingers are flexed, elbows are also flexed. The lower limbs, you will find they are extended, as well as they have an internal rotation and a plantar flexion. The lesion, most probably in this type of a situation, is, as you see here, this is the brain and this is the brain stem, which I had told you earlier, and it is between the thalamus and the red nucleus, which is located here. Between the two, when there is a lesion, you get a decorticate posturing, or even if the cerebral hemispheres are involved more, then you get a decorticate posturing. This decorticate posturing, 30%, more than 30%, they do recover with intensive care management. The next one is a decerebrate posturing, in which here you find it is flexed, the elbows are flexed, whereas in a decerebrate posturing, you will find the upper limbs or upper extremities like this are extended, adducted and pronated like this, turned inwards. That is the upper extremities. The lower extremities will be again extended and plantar flexed. As you see in the slide here, extended, hyperpronated, turned inwards like this, and lower limbs are extended and plantar flexed. This is the classical decerebrate posturing. And in a decerebrate posture, usually the lesion is between the red nucleus and the vestibular nuclei situated in the medulla of the brain stem. This is the site of the lesion. That is where you get decerebrate posturing. Once you give a painful stimulus and you find it is a decerebrate posturing, then the chances of recovery are far remote and only less than 10% do recover. So, this is very, very important. In a comatose patient or an unconscious patient, as you see the patient and give a painful stimulus, if there is a decorticate posture, there will be flexion of the elbow, flexion at the wrist, flexion of the fingers, and there will be extension of the legs with internal rotation. If that is there, it is a decorticate posturing, and the level of lesion is between the thalamus and the red nucleus. Suppose you give a painful stimulus to an unconscious patient, and suddenly you find the patient is extended with hyperpronation, and that means it is as well as the legs are also extended and the ankle is flexed like this. That means it is a decerebrate posturing, and in that the lesion is between the red nucleus and the vestibular nucleus in the medulla. So that in fact is decorticate posturing and decerebrate posturing. If you see that, you can predict the prognosis of this patient, how much recovery he is going to make. This is very, very important for those patients with head injury, a posterior circulation stroke, and so on, both for the neurologist as well as for the neurosurgeon. So that's in brief on the two postures when you give a painful stimulus, the decorticate posturing and the decerebrate posturing, and what it signifies in an unconscious patient. Thank you very much.